Hi, my name's Phil. I like talking about politics, and in amongst the political Brexit storm, we also have another of other Boris Johnson-shaped disasters, and one of them, of course, is our test and trace strategy, which we abandoned early on. We were initially doing this. We abandoned it against all the advice, and then realised we had to restart it, made a mess of restarting it, and it is now in a state of collapse, as warned by Keir Starmer. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So a couple of weeks ago, opposition leader Keir Starmer warned that the test, trace and isolate programme was close to collapse. The systems were reporting worse figures week on week, getting further off the targets. It should have been improving over time. They should have been learning lessons. Absolutely, when it first launched, you wouldn't expect it to be at its best, but it should have got better. It wasn't doing. Boris Johnson took exception to this in last week's PMQs, and he said that he thought Starmer should be regretting those words. If he was, he wasn't saying so. Because throughout this whole sorry affair, Johnson has sought to deflect criticism by bandying about numbers of, oh, we've carried out this many tests, or, you know, we've contacted this many people. And in response, Starmer has just tried to point out what matters is not the numbers in isolation, but the numbers in comparison with what it needs to be. What you shouldn't be focusing on is how many you're testing or how many you're contacting. How many are missing? How many are you not testing that need a test? How many are you not contacting for which you've got details? Because people cannot get tests when they need them. Not enough people are being contacted to isolate, even when tracers have the contact details. And you can understand not getting through to absolutely everyone. I don't like answering my phone, although if you leave a voicemail, I will listen to it. So the odd person may not even do that. Yeah, the odd person you may not get in touch with. Apart from anything else, the odd person might be frightened of getting in touch with that, because isolating, of course, another government-created problem, means for many people statutory sick pay, which is £95 a week, which is not enough to live on. So you're telling people to lay off work for a bit, do without money, which they desperately need when they live hand to mouth. But the fact of the matter is that they are missing huge numbers of people, and it's getting worse. Now, at the start of this week, the news came out that you could not get a test in any of the 10 worst hotspots for COVID in England. So now we're not just talking about a situation where there's parts of the country where you can't get a test, which is bad enough, and they're being told to drive hundreds of miles sometimes. And even then, when they're contacting that test centre, if they're able to do it, or they go, actually, I don't know why they told you that, because we ain't got a test either. And you know, obviously when that's happening, what you're keeping people off work. The government keeps saying how important it is for people to get back to work. You're keeping kids out of school. Government keeps saying how important it is to get kids in school. But in the parts of England where you absolutely know lots of tests will be needed, because I don't know, logistically, I get it's going to be really difficult. You could have a stockpile of tests somewhere where you thought they'd be needed and they weren't. You could have suddenly a local spike build up and suddenly you need loads of tests, but you didn't. It's only just emerged and you don't have them. But we're talking about the ones where you must know we need loads of tests, because these are the worst hit areas of England. We know where the rate of transmission is highest. Why aren't they being prioritised for the tests? You know, I mean, the logistics of doing that at least should be straightforward. Oh, where are the places that have got the most cases? Oh, these places. Should we send them more tests than normal? Yeah, let's do that. You know, people living in these worst hit areas, which any sensible government would prioritise, were told that there were no tests available in walk-in centres, drive-through stations, or to be sent out to affected households. So there was actually no way of getting a test. Zero way. And yet the government and Boris Johnson keep trying to claim that our capacity is way more than demand. That the reason, you know, okay, there is a lot of demand at the moment, but we've still got the capacity. And the reason that not as many people have been tested is because the demand is not high. And then the next answer they'll give, apparently, it's to do with demand. But the first answer, if the demand is not high, how come we're not able to meet demand? And if it's because of the demand, well, okay, are we saying that our demand is greater than in France? I don't think that's true. They're well ahead of us. Are we hearing stories that France is as bereft of tests as we are? I'm not hearing that, and I am looking for that. You know, and if demand is not high, how come we're not able to meet demand? If demand is high, how come we're not increasing capacity? You know, or how come we're not at least admitting that the capacity isn't enough? You know, and that is not a system that's collapsing now. That is a system that has collapsed. It has. If in your hotspots you cannot, not just don't have enough tests, don't have any tests, you actually cannot get a test to someone from any avenue, even if they're able to travel a bit, that system has already collapsed. The programme is simply failing to do what it promised, which means it is not working as it's intended. And speaking of promises, Boris Johnson last week said that he was prioritising frontline healthcare workers. So I'll make no apology for the fact I'm prioritising frontline healthcare workers. Okay, so he's not prioritising the worst hit areas, but he is prioritising frontline healthcare workers. Right? Not really sure why we can't do both, because they seem like both very high priorities to me. Especially as he reckons we're just a few months away from being able to deliver a test for every single person in the country every week. 10 million tests a day. But let's go with that. Let's go with that. So why are frontline healthcare workers also not getting tests when they need them? There are reports of significant numbers of these people unable to get a test. Frontline healthcare workers. How can we have these people who are being prioritised being told by the system that is prioritising them that there are no tests available for them either? And if the people and places that are top priority are not getting tests, what about areas and people lower down on the priority list? You know, I suppose Johnson probably doesn't understand the problem, because after all, every student in his old school, Eton, is getting tested. If he wants a test, he can get one as well. He doesn't really understand that there are parts of the country outside of Eton and number 10. We're also not getting tests back very quickly either. So when tests are going in fact, there was something leaked a bit earlier this week suggesting that some results were never coming back. But that's happened before as well. But in terms of the tests that are coming, they're coming quite late because we're having to send them to laboratories in Germany and Italy again. Our European neighbours helping out there to try and clear the backlog. Despite the fact that we have more laboratory capacity in this country than we are using, but our government have consistently refused to involve itself with independent labs for fear of losing control over the data to the public. And against this background, the government continues to deny the problems. This has been another of Starmer's criticisms. Instead of just identifying the problem, then communicating it to the public and saying what the solution needs to be. Right, I've identified this problem. This is what's causing the issue. This is the solution that will deal with it, and this is what I'm going to do about it, for which Starmer has said on the record he would fully support Boris Johnson under those conditions. Johnson chooses to pretend that the problem simply doesn't exist. So afraid of of criticism, any criticism at all, or anything going wrong. But when you pretend a problem doesn't exist, then it doesn't go away, because the problem doesn't go away by itself. You know, we had summer to deal with this mess, a relatively quiet summer, you know, to get ready before the reopening of schools, which we knew would send the infection rate up, the autumn of sniffles, the winter of flu. But now we're going to get all of these things coinciding with a test and trace system that couldn't even cope before we saw the start of the second wave. Now that the second wave is happening, public health experts, you know, said this. If you have an R value of about 1, as we did last month, and then you reopen all the schools, they said you will need to compensate by shutting something down to keep it at or below 1. Not that we needed a public health expert to tell us that, it's obvious. Now, we didn't do that, and now we can see the result. Ironically, Boris Johnson visited a school when they were just opening to show how safe it was, you know. It was closed down a few days later due to COVID infections. Everyone knew that opening schools, which needed to happen, not criticising that, would result in many more opportunities to spread the virus. Even this problem, the government ignored. Oh, children can't spread the virus, you see, they said, citing research which suggests that very young children have a lower chance of transmitting the virus. Although lower isn't the same as 0, and most children in schools are not the very young category. Most can just spread it just as easily as adults. But nothing else, nothing done to compensate for the opening of schools, nothing done to reset the balance. Pubs and restaurants, the most unnecessary hives of transmission, were left open. And don't tell me we need these open for the economy. Bollocks, do we? By letting the virus run riot, we are hurting our economic activity. I will remind people, economists said this right at the start, now we've got the evidence for it. The UK, who tried to prioritise the economy over health compared to comparable advanced nations, has returned not just the worst infection rates of advanced economies in Europe, but most certainly the worst economic figures of all advanced economies wherever in the world. And the real danger here is that people remain blind to it all because, they said that the second wave might not happen, based purely on the fact that it had not at the time started. But we knew we were not putting in place what the experts said we needed to do to avoid it. The experts said, to avoid a second wave, you need to do this. They didn't do that. So it was inevitable. We're still not putting the right measures in place because we're still not facing up to the issues. We didn't hold the inquiry, so we didn't learn things. So not only will our second wave be worse than the first, as it is for France, it will also be worse than other European nations because we're doing less to mitigate. And the more people buy all the crap in the likes of the Express about some wonderful scheme that good old Dominic Cummings has dreamt up to deal with it all, the longer this will go on. Because until people realise that nothing that was promised has ever been delivered in the way that it was promised, and that it never will be until they demand action and stop being placated by promises for the future which never arrive, this will keep getting worse. And that's without even considering how a no-deal Brexit will impact all of this, whilst also providing a distraction in itself. Saw the news today, it was yesterday now when you're watching this, in Kent. A COVID testing centre has been closed down in 2 weeks. Really? There's no COVID in Kent at the moment? Oh no, there is. Everywhere in the country. Everywhere. The R value is above 1 everywhere. So... And also we know that the second wave is on the upward curve and it's exponential. In 2 weeks' time it'll be even closer to the peak. We're going to close down a testing centre, not move it, close it down. So what's so important that we have to close down a COVID testing centre in the middle of a COVID pandemic, as we're gearing up for the second wave that is almost certainly going to be much worse than the first? Brexit lorry park. A lorry park which is only necessary because of Boris Johnson delivering a form of Brexit that he did not promise in the general election. But there it is. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.